What impact does mental health have on the various issues we debate every day in our economy? My name's Josh Durso, and this is episode number 1 of In Focus, the podcast. Yes, the column and Substack that has been growing pretty significantly over the last year is now going to be a weekly forum where we talk about stuff. We're going to talk about problems and solutions. But I wanted my first guest to be Margaret Morse for a few reasons. One, she's one of the most thoughtful people I've encountered in my career, but also because she said something to me about a decade ago that stuck throughout my career. At the time, I was still a relatively young reporter, and Margaret said something that totally flipped how I thought about journalism and even how communities function at a policy level. We are talking about the big ideas and often lofty goals that come from government, community groups, or other well-intentioned folks trying to address systemic issues. She said, people can't care about the things we're talking about if their basic needs aren't being met. It made me stop in my tracks and all of a sudden changed how I thought about everything. Housing, economic development, mental health, energy policy, addiction, poverty, even political polarization. People don't experience these things separately. They live them all at once. And that's why a column, Substack newsletter, and now podcast that will largely focus on housing, economic development, and stuff like zoning needed to start with this conversation. Margaret is the Director of Community Services for Seneca County. We talked about the work her team does, how rural counties are responding to things like changing funding levels at the federal level, and what the landscape could look like in these communities moving forward. If you have a question or idea for an episode, email it to josh@fingerlakes1.com. You can also subscribe to the show for free by dropping your email in the box below. Now, my conversation with Margaret Morse. So let's start here. Set the stage. Coming into 2026, you and your role, with regard to mental health, what most had your attention? What were you most paying attention to?
Funding. Yeah. Cuts to funding. How will that impact the work that we're doing? How will that impact county costs, support for services? So, yeah, I think that's probably on everyone's mind in my field, anyone who depends on grants or state and federal funds, what that's going to look like. And we still don't know.
Yeah, we still don't have a state budget as of recording this, so we don't really know where that's going. Federal cuts, those mostly happened last year, but there's kind of this like constant change, I guess. For a county like Seneca, and frame this for folks who are watching or listening from rural counties,
Mhm.
how does it affect rural counties, that funding, differently than, say, a Monroe or an Onondaga?
Well, I think that there's just always more resources in urban areas. So we're having to do more with less in the rural communities. We depend more on grants, and I shouldn't say more, but we depend, certainly in my business, depend on federal funding as well as state funding, and some of the state funding we receive flows from the feds. We also serve a significant population of people who are receiving Medicaid benefits. And so with those changes, which haven't all gone into effect yet, we still don't exactly know what that's going to look like.
Yeah.
Who will, work requirements, what that will look like. So I do think that for small rural counties like Seneca, the impact on county government and the workforce is significant, particularly just because there's less resources. And for us in the mental health department, for example, I mean, we're pretty much the only game in town. So it's not like in Monroe where there's multiple providers.
Is it more challenging to, and we're going to talk about the data from the survey you guys did, but is it more challenging to get your arms around what the data actually looks like to access funding in rural counties because it might be a little more labor to actually get to the real numbers, or is just underreporting a bit more of a thing for a rural county?
Yeah, I think it's harder to get to the numbers, and I think because we just don't have as many resources. I mean, in Monroe, they have people who can analyze all of the data coming in from, from law enforcement and EMS around overdoses, for example, or suicides. They have actual specific titles of people who can go through that data and analyze, which is very helpful. Certainly, we don't have those resources, but additionally, relatively, our numbers are so small that, one or two or three or four is hugely significant for us. I mean, one is significant for anyone, but you know what I mean? It's in a small community, those numbers are bigger, but they may not be as significant enough for reporting purposes. So often on, state dashboards and federal dashboards, our numbers are some of our numbers are literally just blacked out because they're not considered significant enough to report.
Yeah. Which is a challenge.
It is.
Last week, a Pew survey found 22% of U.S. adults rate their mental health as fair or poor. Does that number track with what you see? And when you hear that number, what does it say to you?
It tracks. It seems low actually to me, but I would, of course, it may be that I have a skewed perspective because I'm embedded in this work, but that number seems kind of low. It certainly does. What your question was? What does that mean?
What does that number feel? And you sort of answered it already. Does that number feel right to you, or what about that number? Because we talk about, it seems like a lot of the conversation, at least from what I've seen on the media side of things, whenever mental health comes up, it's always a 1 in 5, 1 in 4.
Yeah.
Which, if you zoom out and you think about the whole population, that's really significant. But it almost feels like a bad way to try and synthesize that to the average person who may not be directly experiencing it, or having a conversation with someone who is directly experiencing it, even if they do have close family members who are dealing with it.
I feel like, and I'm not sure that this is answering your question, Josh, but I do feel like in the 10 years or 9 plus, almost 10 years that I've been doing this role in Seneca, that there is more awareness, and that I don't think there's really anyone that you would talk to who doesn't say that they have someone who's struggling with mental health or addiction in their family close to them. So I don't know. I think that the 22% just seems low to me, honestly. I think that almost everyone I talk to can tell you a story, if not their own story. I mean, most people that you talk to can tell you, yeah, I had a period of depression or anxiety, or I suffer from depression and anxiety, and I'm medicated for that, or I go to therapy.
How, and you probably don't have a real number to put on this, but how often do we think that folks are thinking about things like anxiety and not categorize well, that's not a mental health, that's not depression, that's not when I listen to people talk about certain things, especially anxiety, oftentimes it feels like it's put in this ancillary category that isn't mental health. It's just the reality of having to work hard for whatever, you know what I mean?
Right.
Whatever you're pursuing. Could that be part of the underreporting part of it?
Yeah, it's interesting. I mean, I do think that it's on a continuum. I mean, that's not untrue that we all have levels of anxiety that are normal and functional. It's when that depression or that anxiety impairs our functioning significantly that it becomes a disorder. So I do think that it just depends. I mean, some people may downplay it. Oh, this is not really a problem. This is just normal. Or, why don't they just pull themselves up by their bootstraps? We never talked about depression when I was a kid. We just walked through that 20 feet of snow and in bare feet and did whatever we needed to do. So, I think that people can downplay it, but when people are unable to, when it's really impairing their functioning and getting in the way of them, living their lives, is when I think that people hopefully wind up reaching out for help.
That same survey, you said 22% felt low. This number I thought felt even high for as much as we hear about it. For people under 30, that percentage of those who rate their mental health fair or poor jumps to 36%.
Yeah,
Does that feel more on track with
it
what you see
does.
across the board?
It does. And if you look at the Clyde survey that we did in Seneca, and I don't have those numbers off the top of my head, but I think so that's the youth survey,
Yeah.
the youth risk survey. And, those numbers track for, levels of depression and things like that among our youth in the surveys that we did in Seneca. Again, I don't recall the exact numbers, but that seems to be more on par from my perspective.
What's driving it? What's driving it among we'll say the younger adult contingency, and then the rest of the population? Are they the same contributing factors, or do they vary a little bit?
I think that, I mean, that's a really great question. I think that for youth, they're dealing with so much more than what we had to deal with when we were kids. Well, they have the same issues that I think we have all had throughout history, friends and bullying and all those things that have always happened. Having said that, I really think that social media and screens are just a huge factor. I mean, we've talked you and I have talked about that before, Josh, in some of our conversations. And I just, the numbers are glaring really in all of the studies. And I do think that, we have these generations of kids now who have grown up never not having screens, never not having phones. And we know that it's changing how their brains work. It's changing their attention capacity. They are more depressed and more anxious, not only just because they're never able to shut down from it, but because the way that social media platforms literally target and create addiction basically
Yeah.
to these platforms and to to social media is I mean it is rewiring brains. And so I mean it'll be very interesting to see what happens as these generation of kids who have never not had screens become adults. I mean, I guess they're probably already young adults at this point, but I do think that that's driving a lot of it. They don't have the same attention spans. They're never able to get away from it. The doom scrolling mm, for even like the 20-year-olds, let's say, who are politically engaged and looking at what's going on in the world, they can never get away. The algorithms that catch them if they're interested in what's going on in other countries, wars and things like that, they can never get away from it. And I think that can be very depressing and anxiety provoking and make people feel very, very helpless. I mean, bad things have always been going on in our world forever, but we could be in our smaller worlds where we felt we could make a change and make a difference, and we weren't as exposed to all of the things all of the things that the media thinks will gain our attention, the bad things usually, the sensational things. They can never we can't either really ever get away from that without shutting off. And
Yeah.
that's a really hard thing to do because they're all addicted.
Yeah. Uh, how does that square with? Because I'm just thinking about what the argument, devil's advocate, I
Mhm.
suppose, would be from the social media companies who would say, "Well, look, we're helping people find other people with
Mhm.
like interests, et cetera, et cetera, et cetera." But pretty much every mental health survey I've seen points at loneliness, isolation, people feeling like they don't belong in
Mhm.
pretty significant numbers too.
Mhm.
Not minor numbers by any
Right.
means. So how does that square from your point of view?
Right. I do think that, you know, I'm not trying to be reductionistic in terms of saying this is, social media and that this is all bad, because I don't think that that's the case. I do think for certain people who are isolated and lonely that social media can be a lifesaver for some people. I mean, people who have severe social anxiety or transportation issues or whatever it may be, where they're not able to get out and be in groups, or they're from very small rural communities where there's not access to lots of supports. can get on to 12-step groups and other support self-help kinds of platforms and anywhere in the world. They can always have access to that stuff, and I think that that's huge, and we do recommend to the people that we work with that they access some of those things, and I think that they find it very, very helpful. So there's always the good and the bad.
Is the good overstated though? Because when I listen to that argument, and I wasn't trying to defend social media
No,
companies at all.
yeah,
Quite the opposite. Like when I hear that argument, it feels like the only argument they can make at this point. Like it feels like the only thing they can point to is, well, we've kind of created community because literally nearly every human being on Earth is online in some way, shape, or form.
right.
But the negatives seem to be a long and oftentimes never-ending list of impacts on human life. So does it feel like that the good is now at this point kind of like just overstated?
Yeah, I don't know. I don't know the answer to that, Josh. I think that certainly even the connections that people do make, you have to wonder how real they are because people aren't necessarily showing their real selves on social media, and that's part of what teens and young people, for example, and probably all of us are impacted by seeing, all of these beautiful, wonderful, perfect lives, and we compare ourselves to that. Kids, especially, I think, young, teenagers, and that's very challenging for them and makes them feel poorly about their own lives. And yeah, I mean, I think, and then I think about our older populations, and of course, we have a growing older population in our community, and that's a whole other segment of the population that are utilizing technology in a way that can be pretty scary because I have a mom who's about to be 81 years old, and I'm constantly having to help her
Mhm.
get out of these terrible situations where people are trying to scam her, where she's given out her information. And they're very clever about it. It's not that people aren't smart. But if they're not experienced, obviously, and maybe more gullible because they don't have as much experience as we do, or even younger people, trying to see what is real and what is not. That's, really impactful, I think, on the older community as well. We don't always talk about that, how that community is impacted by technology.
Uh, your data, the data from Seneca County.
Yes.
What were a couple of the things that stood out most to you from this most recent round?
Well, I mean, it wasn't surprising, honestly. It was a small sample, so I'll say that, but interestingly enough, very reflective of other studies out there with much larger samples. I mean, this was just a sampling, totally anonymous, of people who receive services from our county mental health clinic. And what it showed was that, about, if I'm remembering correctly, you know, 25%, right, or right around there is that number that we keep kind of talking about. About a quarter of the people talked about feeling lonely and disconnected from their community and feeling like they did not belong. And those things were directly then correlated in significant ways to negative mental health impacts. People who who reported being lonely and disconnected, feeling that they didn't belong in their communities, reported that their mental health clinicians were among their n- only supporters. And so that speaks to the work that we do. And of course, that's part of the reason that we did this survey is we're hoping that it will inform the program development over, at the county, the way that we build our services. And what we're realizing more and more is that, yes, obviously we do medication management and it's so important. And we do therapy with people to help them to manage their emotions and to learn skills. But those social determinants of health, those community connections are so key to people's wellness. And, as we've talked about before, without those things being in place, it's very hard to move the needle on anything else.
Social support was something that stood out from your survey, and it looked like almost half of those in the survey needed more social support. In
Yeah.
a rural county like Seneca, what exactly does that look like?
Yeah. I mean, that's a challenge,
Yeah.
especially we find with the elderly population that we work with. People, we have a great office for the aging, and I've learned so much actually in the last couple of years because of some of this work around social determinants of health that we've been doing about the amazing services that they offer. But yeah, I think in a rural community, that makes it much harder.
Yeah.
Transportation is more challenging, but interestingly enough, we did find that people on the south end of our county, again, not for those of you who live in Seneca County, not surprising, felt like reported less sense of belonging than people on the north end of the community. And that was controlling for transportation. So even if they had transportation,
Yeah.
they still felt that they didn't belong and they experienced more isolation. So I think that speaks to obviously the south end of our county is a more rural county, more rural part of our county, and there's less pro-social kinds of activities, places to gather, and I think that's a huge issue. So I don't know the answer, but I know that it's a really important thing for us to be looking at, that we need to find ways to help people have opportunities for healthy social connection, to help build people's ability to feel a sense of belonging in their community, that is foundational to mental wellness.
Yeah, and I think another thing for folks listening who aren't from Seneca County or a county shaped like Seneca, you're talking about roughly if you're going from Lodi, the southernmost point of the county, up to Tyre, the northernmost, like a 35-ish minute drive. If
Yeah,
you're just driving from south to north or north to south. So to your point, even if you have a vehicle, that is a significant time commitment if
it
you're
is.
really traversing to the north side, where there is more of the social activity, I guess, happening.
Well, and
Um,
with the cost of gas now, I
yeah,
mean, that really, makes, even if you have transportation, it it costs a lot to keep your gas tank filled.
yeah. Going back to one of the conversation starters, I guess, for why we're even talking about this today, are we separating too often life, like basic life stability, from the mental health stuff? So, housing, transportation, social connectivity, and just treating mental health as mental health instead of treating it as a major component of overall life stability that is just as important as being able to commute from A to B or having reliable housing that you're not concerned about disappearing in a couple months.
I think it's completely connected, and yes, I do think that we separate those things out in a way that's not helpful. And the same goes for all of, we're talking about mental health, it's Mental Health Awareness Month, but addiction is also a mental health issue. And so, historically in the treatment field, the field of addictions has done a much better job than the field of mental health, in my opinion, at addressing social needs. And that has to do with the fact, in my opinion, again, that the field of addictions treatment came from the rooms. So for those of you not in the addiction, not familiar with the addictions world, so to speak, the rooms is like the 12-step programs. And so AA and NA and those sorts of things. And so community has always been a huge part of the recovery community of recovery work for addictions treatment. Whereas mental health has been far more medical model. And so that work and that research and that recovery stuff for mental health really comes out of psychiatry and medicine, which has had much less of a focus on the whole person and the community perspective. So historically, the addictions field has done a much better job. I mean, again, for those of you who may not be familiar, but that whole people, places, and things is key in recovery. There's been a huge focus in the addictions recovery work that we do on getting people back to work. Vocational counseling is part of the funding and part of the requirement that the state OASAS, the state funder for addiction services, has for those services. And so when you're treatment planning and you're following like the guidelines of the state funding and licensure entities for addiction services, there's a huge focus on those social determinants of health. That has not been historically the case for mental health. Having said that, has become much more of a focus. Our Dr. Sullivan, our commissioner, and Governor Hochul have put funding, have put a focus and prioritized these sorts of things in the work that we do around mental health. However, it still lags behind in terms of the culture, right? And when you go to, I graduated from social work school a long time ago. But as I talk to new social work students and mental health counselors coming out of college, they aren't really taught a lot about this. It's very much focused on really important things, on how do you diagnose mental health disorders? How do you treat depression? How do you treat anxiety? What are the different family therapy modalities? These sorts of things are very, very important. However, I do think that these school programs could really benefit the up and coming, the new round of social workers and mental health counselors and clinical providers for all of these fields, on really helping clinicians understand how important those foundations, that Maslow's hierarchy, the foundations, the social determinants of health are to mental wellness. And you cannot effectively help someone with their mental health if you are not addressing those social pieces. It's just they are completely interconnected. So I think I think it's coming along, and the education is coming along, but it's very, very challenging. It's one of the most challenging things I think that the clinicians that work in in our service have to face because there's not a lot of time.
Yeah.
And that's very time consuming to help people with those issues. And additionally, there's not a lot of resources. I mean, there is a housing crisis. The Board of Supervisors has put out a resolution, and I guess it was last year in 2025, that Seneca County is in a housing crisis, along with all of the other rural counties in New York State. We're not alone.
No.
But, you know, if people don't have adequate, safe housing, food, they're wondering, are they going to be able to make their check last?
Mhm.
Uh, how can they even focus on their mental health? I mean, yeah.
It's interesting because it now, like, being this far into the conversation, it seems like there are like three main pillars. There's the treatment, which everybody thinks about, the clinical side of it. That makes sense. Then there's the sort of like structural side of it with the housing and, the stuff you need day to day to survive to the next day. But then there's like the community piece in the middle.
Mm-hmm.
And it almost sounds like you're saying like the addiction treatment side has done a better job of creating community and wrapping community around first
Yes.
with everything else. And that's the piece that's kind of was lagging and is now coming
It is.
around on the mental health side.
Yeah, I think that explains it really, really well. There is that piece in the middle of community that, again, yes, the field of addictions has done a much better job of building community. And so that's really, I think, where we need to be going in order to be more effective. Is we need to find ways to build community. We do have a social club at the drop-in center right here in Seneca Falls. And we are trying to look at ways that we can expand the community that serves. It has historically served a fairly specific community that may not appeal to everyone. So we're really looking at ways that we can grow that and have it be more appealing to people throughout the spectrum of mental health disorders. We do partner with FLACRA. They have a satellite, so to speak, of their recovery center. Their main recovery center, Connections, is in Canandaigua, and so they're funded to provide some recovery supports on the second floor of that building, and that's been a great opportunity for building community here, rather than having our peers, because we do have a nice peer support, peer advocate or peer support services program here in Seneca, and so that's been a nice addition to that. And that folds in people who also have mental health disorders, but it is an area that I think, I think it's a good thing that we've identified this as an issue because it gives us a path forward.
Yeah. Yeah. I don't know if this is a typo or maybe I was seeing double or triple when I wrote this down. Seneca County provided about 34,000 outpatient services in 2025.
Yeah, yeah,
That's a little more than the actual population, I believe,
it
of the
is.
county.
Yeah.
Okay.
Yep. And that doesn't even
Lots of questions.
Yeah, those are like clinical services, so that doesn't even count the case management services or the other kinds of support services that we would provide outside of clinical services. So there's even a lot more going on than just that.
But at least one service for, practically speaking, every human being that calls Seneca County home.
Yeah.
Not across the
Right.
entire population,
Right.
but an equal number of. And how many
People?
humans are actually like working on providing 34,000
Right.
services per year?
Right. So we have about 40 clinicians.
Okay.
Yep. And then all of the support people that make all of that work possible.
That's a big number.
That we couldn't do without. Yeah. And that's, I'm trying to recall, I don't want anyone to quote me on this because I can't, this is not an exact number. I'd have to pull it to give you an exact number. I could, but I think we serve about 3,600 people a year. And at any given time, we have about 1,500 active patients. So just to be clear to someone who might not kind of get the full picture, those 35,000 services were to that approximately 3,500 people. Yep. But yeah, it's a staggering number of services.
Also, not nothing. That would break down to roughly like 10% or a little less than 10% of the population. I mean, that's for a rural county, especially.
Absolutely,
that's a significant number of people. How does that number compare to, say, the last few years? Is it trending up? Is it flat? Is it down?
Trending up.
It's trending up.
Yeah, it's trending up. And I would say that we're trending up. We're tracking, if maybe not trending up a little bit this year.
Mm-hmm. I can already I can hear or see the comment that some folks might or response some folks might have to hearing that. Well, maybe the county's providing more services. Maybe that's why. Maybe they have more access to more services in Seneca. So you're providing more services. So of course the numbers are going to be bigger. Mm-hmm. Is that part of it, or is this just sort of trending with how things had been trending, prior to the last couple of years?
Well, I think that that's true. We are providing more access to services, but we build our services based on community needs assessments. So, it's not like if we build it, they will come. It's they're wanting to come, so we need to build it.
Yeah. Yeah. Mental health is not economic development. Okay. A couple quick questions that I wanted to get your thoughts on before we wrap up here. First one, the word trauma. It gets thrown around on social media all the time.
The word
trauma. Could you put like a definition on it and then sort of contextualize it with how you, in the work you guys do day in and day out, what trauma actually means, and not just sort of I hate to say it, it's kind of a catchy flip phrase that gets thrown around on social media a lot.
Sure.
Had to stand in line at Starbucks a little longer than normal. traumatic experience.
Horribly
No,
traumatic.
not yet.
Yeah.
Not the same thing.
My computer took 5 minutes to load.
Right.
It was traumatic
Yeah.
this morning. Yeah. So obviously we all have trauma, and I don't mean the having to wait for your computer to load trauma, but we've all maybe seen something that a car accident or the death of a loved one or something to that effect that is considered a trauma. But when we talk about the trauma that is impacting the people that we work with, we're talking about trauma in childhood, child abuse, child neglect, sexual assault, these sorts of traumas, combat. I mean, that's really where the word, right, trauma and PTSD comes from, what used to be called shell shock. Um, and so, the field of trauma work comes out of work with veterans. But so that's really what I'm talking about when I'm referencing that 70 to 75% of the people that we work with report trauma. They're reporting trauma that means like they have had some sort of child abuse or neglect growing up. They've experienced sexual assault. They've witnessed domestic violence or experienced domestic violence. Those are the sorts of things that I'm referring to.
Yeah. Last question. I think this one's going to be good for even if you're not listening in Seneca County. If rural communities could make one practical investment to improve mental health outcomes, what would it be? What, with the experience you have, what's one thing that you could point to that either a little more or something new or something different? What would it be?
Yeah, I think that it's a challenging question. I think that there's a lot of different things that need to happen. So I don't want to say, that this is like the one big bang for your buck kind of a thing. Having said that, though, I do think that programs like Healthy Steps or I can't recall the name of the program offhand, but it's something that I'm very interested in. M- Connecting community mental health workers or community nurses to pregnant women who have been identified as at risk for mental health or substance abuse while they are pregnant, connecting them to that community health nurse who then supports them throughout their pregnancy and then into year 3 or 4, I think is huge. I also think on top of that, and it's very much connected, is that early intervention piece. So something that we are really excited about in Seneca County, we added 0 to 4 to the clinic's operating certificate in 2025. And we are building and focusing significantly on the 0 to 5 population. So early intervention is key. And I don't know that, and I don't think this is specific to Seneca County, but in general, I don't know that we have done a great job across New York State or across our country focusing on prevention. And I think that that's really where it's at, is really building programs that that target and focus on moms and families and kids even before they're born into those 0 to 5 years, and assisting and supporting them and building resilience and protective factors. If we can get to these issues and support people before they develop mental health and addictions, then I think, that would be the bang for our buck for sure.